As I speak to you tonight, our hospitals are under more pressure from COVID than at any time since the start of the pandemic. In England alone, the number of COVID patients in hospitals has increased by nearly a third in the last week to almost 27,000. And that number is 40% higher than the first peak in April. On the 29th of December, more than 80,000 people tested positive for COVID across the UK, a new record. The number of deaths is up by 20% over the last week and will sadly rise further. And my thoughts are with all those who've lost loved ones. You may only leave home for limited reasons permitted in law, such as to shop for essentials, to work if you absolutely cannot work from home, to exercise, to seek medical assistance, such as getting a COVID test, or to escape domestic abuse. The full details of what you can and can't do will be available at gov.uk/coronavirus. If you are clinically extremely vulnerable, we're advising you to begin shielding again, and you will shortly receive a letter about what this means for you. And because we now have to do everything we possibly can to stop the spread of the disease, primary schools, secondary schools, and colleges across England must move to remote provision from tomorrow, except for vulnerable children and the children of key workers. We will provide extra support to ensure that pupils entitled to free school meals will continue to receive them while schools are closed, and we will distribute more devices to support remote education. I completely understand the inconvenience and distress this late change will cause millions of parents and pupils up and down the country. Parents whose children were in school today may reasonably ask why we did not take this decision sooner. And the answer is simply that we've been doing everything in our power to keep schools open, because we know how important each day in education is to children's life chances. Today, the United Kingdom's chief medical officers have advised that the country should move to alert level 5, meaning that if action is not taken, NHS capacity may be overwhelmed within 21 days. Of course, there's one huge difference compared to last year. We're now rolling out the biggest vaccination programme in our history. So far, we in the UK have vaccinated more people than in the rest of Europe combined. With the arrival today of the UK's own Oxford AstraZeneca vaccine, the pace of vaccination is accelerating. I can share with you tonight the NHS's realistic expectations for the vaccination programme in the coming weeks. By the middle of February, if things go well, and with a fair wind in our sails, vaccinating all residents in a care home for older adults and their carers, everyone over the age of 70, all frontline health and social care workers, and everyone who is clinically extremely vulnerable. If we succeed in vaccinating all those groups, we will have removed huge numbers of people from the path of the virus. And of course, that will eventually enable us to lift many of the restrictions we have endured for so long. If we can steadily move out of lockdown, reopening schools after the February half-term and starting cautiously to move regions down the tiers. I want to say to everyone right across the UK that I know how tough this is, and I know how frustrated you are, and I know that you've had more than enough of government guidance about defeating this virus. We must pull together. You should follow the new rules from now, and they will become law in the early hours of Wednesday morning. Parliament will meet largely remotely later that day. I know that the devolved administrations in Scotland, Wales and Northern Ireland share my conviction that this is a pivotal moment, and they're taking similar steps. The weeks ahead will be the hardest yet.